everybody, I'm Sarah with Fuller Teaching Resources, and it is October, which is ADHD Awareness Month. And so I thought I would take the opportunity to talk to you a little bit about my ADHD and how it affects my life and how I got diagnosed over a series of videos. So today's video is going to be our first one, and I wanted to talk a little bit about how I ended up getting a diagnosis. So for me, I started with a self-diagnosis, and for years I had heard about ADHD. It was something that I didn't identify with because of the hyperactivity aspect of it. I have been described as hyper, but it's more like I'm high energy. And I didn't have a problem, sitting still during school, and I was well behaved in school, so it never really came up for me. As I learned more in my education classes, and then as I learned more as an educator, I started to think the symptoms sounded like me. I was concerned, though, that maybe it was one of those hypochondria things. My dad is a doctor, and he said when they were in med school that every time they learned about a new disease, they all thought they had it. They would find the symptoms that sort of lined up. I was concerned that maybe I was doing that. Maybe I was making too much of it. But eventually I found some lists that compared symptoms in childhood to symptoms in adulthood. And I started looking at these symptoms in childhood, and I was like, check, check, check. This really sounds like me. Things about not being able to keep their area clean. I was the kid whose desk never closed, whose lockers were overflowing, who lost things within their own backpack. My room was never clean. Quick to anger. I was able to control that at home or at school, but at home, I got very frustrated very easily. I have a pretty significant anger issue when I was at home. The performing academically at a level that is not in alignment with their capabilities. And this was a big one that got me. I got kicked out of AP English, even though in fourth grade, I tested at an 11th grade reading level, and in high school, my ACT and SAT scores were in the 90th and higher percentiles in English. And so my GPA was never great. I knew I wasn't dumb, but school didn't come easy, and I forgot a lot of things. I missed deadlines, and I'll talk more about that at another time. And then when I was looking at some of the adult things, especially for adult women, because there's a lot about, as you get older and certain things come up and you don't have the systems built in, like your parents asking you, is your homework done? That it starts to show up more. And that's exactly what happened to me. I have a very hard time just doing what I call being an adult. And I've felt a lot of shame surrounding that. I have spent a lot of time Googling, what do adults do when they get home from work? What does after work look like? None of this comes naturally to me. My house is always a mess, and I know it's a mess, and I technically know how to clean and to organize. I'm not bad at it when I do it. I'm bad at keeping it up, and I'm bad at getting started at it and finishing it. And it's so frustrating, and it's embarrassing, and I just felt broken. For honestly, most of my life post high school. I'm one person who would go back to high school in a heartbeat. I liked it. Even though I didn't excel as much as I should have, I did okay there. The structure, I needed that structure. It worked for me. I'm lucky enough that I am pretty intelligent. And so even though I didn't get the grades I should, I didn't necessarily end up failing the way some other people did. And I did have a group of friends that were very academically minded. My parents were very much on top of me, and I had teachers who cared a lot. And so that helped me from falling completely through the cracks in most cases. But there were a few places where I did. So I kind of had started to try the diagnosis on for size. I started doing more research, and everything I saw kind of confirmed for me. But I ended up actually having stomach issues that were causing me to have to cancel class teaching college at the very last minute. I'd already be at work, and I would get sick to my stomach and I wouldn't be able to get into the classroom. And it was happening multiple times that one semester. So I'd gone to the doctor, and she was giving me meds to try to help me. But one thing she mentioned to me was have you ever had any anxiety or depression and things like that? Because those can affect your gut health. I have. And anxiety is another thing where I've kind of felt like I had some of it. Certainly not to the extent that a lot of people have. I don't have panic attacks frequently. I don't have a lot of the stereotypical signs of it, but I do know that if I'm nervous about something, my stomach does get very upset. It often makes me sick and things. And she was, I can recommend that you go and get a psychological evaluation. And maybe if you handle some of that, it will also help your stomach. And so I decided that I was going to go and do this. And I've been to, shrinks and doctors before. I mentioned my anger problems from childhood. So I've seen people been on and off antidepressants from middle school on. So I went to get tested or to evaluate it. And the first person I see, the way it does it is they just like run through this really long list of questions about everything. And I answered and I tried to be as forthcoming as possible. And she did ask like if I had any personal concerns. And I said, I'm curious about anxiety. I've been diagnosed with depression before. And I personally believe I might have ADHD, but I'm not a clinician. At the end, she was like, okay, well, do you want to see somebody about meds and do you want to see a therapist? But she hadn't said you have this or you don't have that. I was like, should I? Like you just did the whole thing. And she's like, well, I don't diagnose. That's not my role. And I said, that's fine. And I understand that. In your professional opinion, looking at my answers, do you think I would be well served in taking the time to go see somebody about meds or to go see a therapist? And she said yes. And so I decided to do both. I have no problem with the idea of meds, but I do also truly think that they aren't like a cure-all. And so I wanted to make sure that I was also getting therapy. And I'm so glad I did it. I ended up like hitting it off with my therapist. And I really liked the psychiatric nurse practitioner that I saw. She's the one who finally did the diagnosis of generalized anxiety, depression, and ADHD. And one of the things that's like really interesting for me, and I'm sure it's true for a lot of people, is how those correlate. So if I'm feeling depressed, I'm less motivated. And so I'm less likely to like clean. That's definitely exacerbated by my ADHD. But then being in clutter can give me anxiety, which leads, so everything is like so interconnected. When she gave me an additional checklist, she was like, you are very much like kind of a standard case of ADHD. And that it is something that happens with a lot of people who are intelligent and people who have been successful and found ways to be successful, but it comes up in other places. And so finally having that official diagnosis and deciding to try meds lifted a bit of a weight off my shoulders. But one thing I found out is that an ADHD med does not snap you out of it. It has allowed me to maintain my attention span for longer, but it doesn't magically give me motivation to do things like grading papers or cleaning my house. It doesn't create new habits. So one of the things that I continue to struggle with, and this has been a few years now, I was diagnosed at the age of 33, is creating systems that work. I still want to know, what do people do in the morning? What do people do when they get home? What's normal? I just know I'm not normal and I'm not typical. I still am dealing with some shame. But the thing that I am working on and I'm accepting more is that it's not a personal failing on my part. It is something about how my brain functions. And that's something I want to talk more about in future videos, is about the science of ADHD, because still to this day, sometimes when I talk to my parents and I ask, why didn't we figure this out earlier? Why when I was getting kicked out of AP English, did you not like question it when you know that like that's like my subject, that's my jam? And my mom says things like, well, you were just lazy in high school. And I'm having a really hard time getting them to understand that I wasn't purposefully being lazy. I had something going on in my brain that was keeping me from being the best me that I can be. And to this day with, my house, she's like, well, just clean it. Well, yeah, if it was that easy, it would be clean and it would always be clean. But for me, it is not that easy. I often hate myself for it. In the past 12 months, probably more, I have only had 3 people inside my house. I will not let anybody else in. And I hate that because I do like having people over. I like being social. And even before the pandemic, I just wasn't, because I was ashamed to show anybody. So I'm trying to be more open. It has been amazing to find communities of people either here on YouTube, or there's a bunch of adult women with ADHD who are on TikTok who've been talking about their struggles. And it's been amazing to see how similar our stories are. There are certain parts of their houses that look exactly like mine. And that has been huge, to feel like I'm not alone. And I know that as I keep working through things, I'll keep getting better. In some ways, the virtual world has helped me, and in some ways, it has hindered me. But I feel more empowered now than ever before in terms of this. And there are a lot of positives that come from having ADHD for me, and I will do a video on those as well because it's not full on curse, but it does explain so much about who I am, how I am, why I do the things I do. And so if I can help anybody else feel a little more normal and a little bit more like they're not alone by sharing, my story and what I've learned, then I'm all here for it. Thank you for listening. If you have any questions or there's things that you'd like me to address in a future video about ADHD, please let me know. I know that I haven't always found exactly what I was looking for when I was searching for things. So if I can help fill those gaps, then that's what I want to do. Have a great day, and I will see you next time.